is a Channel 9 breaking news report.
We are cutting into programming right now to bring you breaking news about a case of coronavirus now in North Carolina.
We're standing by to take a news conference live from Governor Roy Cooper, expected to talk about one person in North Carolina who has tested positive for the coronavirus. That person is said to be doing well and is now in isolation at home.
Now, that person actually is from Wake County, but apparently, according to the state, traveled to the state of Washington and they believe was exposed at that same long-term care facility where there's an outbreak of coronavirus right now. So they went there. This is in Washington state where they've had 9 deaths, came back to North Carolina. Again, that person doing well, so that's good news, in isolation. But of course, now a lot of concern about who that person was in contact with. And the department officials say they're trying to find those close contacts and monitor the symptoms to contain the spread. But as we've seen, Erica, this starting across the globe and making its way here to the States, and now a case confirmed. The CDC will have to do a double confirmation of that, but a case confirmed here in North Carolina.
That's right. Again, the CDC will have to confirm that presumptive positive test. Right now, I want to show you this image from that center in Washington state where that person has reportedly gone and now back in North Carolina. Let's go now to Governor Roy Cooper with this live update on, again, this first presumptive positive test in the state.
We're here to update you on information related to the new coronavirus and what it means to our state and your families. First, it's important to know that the health and safety of North Carolinians is our top priority. The task force that I appointed and our public health experts have been working around the clock to ensure we are prepared. Our state lab has been testing for the new coronavirus, and today we have confirmed our first presumptive positive results for the new coronavirus in North Carolina. The person from Wake County, North Carolina, traveled to the state of Washington and was exposed at a long-term care facility where there is a current outbreak of the new coronavirus. Local health department officials are working to identify who else may have been exposed to help contain the spreading. The person is doing well and is in isolation at home. We've been preparing for this, and we do expect to see more cases in North Carolina. We are working closely with local health departments, healthcare providers, and others to quickly identify and respond to new cases. Yesterday, I was part of a call that included other governors as we were updated on federal actions. We're providing resources to and hosting regular calls with local health providers and partners. There are also important and common sense steps that you can take to protect yourself and your families. The simplest steps are the most important. Wash your hands often and avoid touching your face as much as you can. Cover your mouth and nose when you cough or sneeze. Clean and disinfect surfaces frequently. Stay home if you're sick, and have a plan in case you need to miss work. People who have concerns about this new virus should contact their local health departments. I encourage businesses and employers to review policies for remote working and make sure workers aren't being encouraged to come to work when they're sick. Know how to reach your local health department in case you have questions. The same goes for schools and child care centers. Finally, I'll say there is a lot of bad information out there. Make sure you are getting information from reliable sources. You can visit our North Carolina Department of Health and Human Services website. It's ncdhhs.gov/coronavirus for updates. I know people are worried about this virus, and I want to assure you that the state of North Carolina is prepared. Our most important work is keeping people healthy and safe. I'm joined today by the Secretary of the North Carolina Department of Health and Human Services, Dr. Mandy Cohen, our State Public Health Director, Dr. Elizabeth Tilson, our Secretary of Department of Public Safety Secretary, Eric Hooks, Mike Sprayberry, our Director of Emergency Management, and we have with us the Public Health Director of Wake County, Chris Kippis, with us today. I'm first going to recognize Secretary Cohen for a few remarks, and then all of us will be ready to take your questions. Secretary Cohen.
Thank you, Governor. Good afternoon. I'm Mandy Cohen. I'm the Secretary of Health and Human Services for North Carolina. Just to give you a little more information about how we have been preparing and continue to prepare to respond to COVID-19 or the new coronavirus. First, our public health team, in coordination with emergency management, have proactively stood up our preparation work starting back in January. We put together an aggressive containment strategy of rapidly identifying suspected cases, testing them, and doing any contact tracing. Yesterday, our state lab began testing cases, which means we can get results faster and respond faster. And we continue to monitor returning travelers through our local health departments to prevent the spread. We've also, as of last month, the governor mentioned we stood up and formalized our work in our new novel coronavirus task force, and thank you to Dr. Tilson and to Mike Sprayberry for chairing that task force. We continue to collaborate daily, sometimes talking multiple times a day with our federal, state, and local partners. Our teams at the Department of Health and Human Services and Public Safety are developing detailed response plan for a range of the scenarios as we move forward. We have been continuing to prepare with our healthcare providers and facilities to streamline and standardize response activities, including having regular calls and mobilizing resources. And as you know, we've been sharing guidance on how folks can think about proactively preparing for themselves. Guidance for healthcare workers, guidance for childcare, employers, schools, colleges, universities, again, all on the website the governor mentioned. And today, because we
all right,
know
listening
that
here live to this press conference in Raleigh where Governor Cooper confirmed there has been a case, a positive test for coronavirus, a person there in the Raleigh area in Wake County who they believe got it by traveling again to Washington State at that long-term care facility where they have had that rather large outbreak and has brought it here. Of course, this is a story that we're going to be following very closely and working on for Eyewitness News at 5 o'clock, something a lot of people predicted would happen. The person doing well, which is good news, but as we talked about earlier, this is a confirmed case. The CDC will confirm it, but who else have they been in contact with? And, you know, who else could have this and not even know it? Because they say not everyone might get sick from it.
Right. And they also added that they do expect to see more cases, but they say the state is prepared to handle this. I want to give out this number quickly. The coronavirus hotline in North Carolina for people who have any questions, 1-866-462-3821. That's 1-866-462-3821. That 24-hour helpline staffed by doctors and pharmacists to answer anybody's questions that they might have. And they also reviewed a list of things that people can do to try to prevent the spread and protect themselves.
Treat it kind of like the flu. This has got a lot more attention this year. So we'll have more on that today at 5. Of course, it is Super Tuesday, Election Day. We just have a lot going on. A lot to tell you about changes in Charlotte at the Catholic Diocese because of coronavirus. All those details coming up at 5 o'clock. We'll see you then.